Imagine this. You're working 2 jobs. You don't eat out. You skip vacations. You save every dollar you can. Then one day, chest pain. You rush to the ER. A few tests, a short stay, and you walk out alive but $87,000 in debt. Welcome to the American healthcare system, where surviving can bankrupt you. But here's the real question. Why is healthcare still so unaffordable in the richest country on earth? Stick with me, because by the end of this video, you'll not only understand why it might just change the way you see your own health and your future. And no, this isn't a conspiracy theory. This is real. This is data. This is America. Let's start with something no one likes to talk about: paperwork. In the US, healthcare is buried under a mountain of administrative costs. For every doctor treating patients, there are about 10 people handling billing, coding, and insurance forms. We spend 4 times more on healthcare administration than other developed countries. All this complexity doesn't lead to better care. It leads to confusion, delays, and waste. Hospitals need entire teams just to talk to insurance companies. It's like trying to decode hieroglyphics with your life on the line. And yet, despite the billions spent, wait until you hear what that money doesn't cover. Let's talk about insurance companies. We're told that competition lowers costs. But in reality, most Americans only have 1 or 2 insurance options. That's not competition. That's captivity. These companies raise premiums, deny claims, and slash coverage, and we're stuck paying more for less. It's like going to a restaurant where your only 2 choices are overpriced or undercooked. And here's the kicker. The less they pay for your care, the more they profit. We're not their customers. We're their business model. Let's move to prescription drugs. Why does insulin cost $300 in the US but only $30 in Canada? Same drug, same manufacturer, different rules. In the US, our government doesn't negotiate drug prices. Big Pharma sets whatever price they want, and we pay it. Some Americans ration insulin, skip meds, or go into debt for basic prescriptions. Other countries don't allow this. Why do we? If the rest of the world can make medicine affordable, why can't we? Here's something that should scare all of us. 2/3 of all bankruptcies in America are linked to medical debt. Most of those people had insurance. An accident, a diagnosis, a bad year, any of it can leave you buried in bills. And when you're sick, stressed, and scared, you don't have time to argue with insurance companies or read fine print. You know what's more expensive than healthcare? Not having it. This isn't just a personal crisis. It's a national emergency. So why hasn't anything changed? Simple. Money. The healthcare industry spends over $700 million a year lobbying Congress, more than oil, defense, or tech. They fund campaigns, they write legislation, they protect profits. Every time reform is proposed, there's a flood of lobbyists ready to shut it down. Because as long as the system stays broken, someone's getting rich, and the longer we wait, the higher the cost for all of us. Here's the truth. It doesn't have to be this way. Other countries have figured it out. They're not perfect, but no one is choosing between cancer treatment or keeping the lights on. No one is starting GoFundMes to survive. We have the tools. We have the knowledge. What we lack is the courage to act. Change starts with you, watching this video, learning the truth, and refusing to accept the status quo. So what can you do? Share this video. Ask your elected leaders where they stand. Demand accountability. Vote like your health depends on it, because one day, it might. And when that day comes, will you be covered? Subscribe for more stories that matter. Drop a comment with your experience. This is Standpoint. See clearly. Speak boldly.